Hello, and welcome to Lesson 1, Intro to Computed Tomography of the CT Blueprint course. All right, so in Lesson 1, we're going to go over some pointers on the introduction to computed tomography. So some of you may know this information, you may not. It'll be a good refresher if you know it. So figured I'd start out with some things to kind of get you up to speed as far as how CT has evolved. Now, some of these lessons will be short, and the important things that I think and I feel that you need to know while you're doing your CT training, I'll make sure those episodes those lessons are going to be a lot longer. So make sure you have your notes, your coffee, and your headphones, okay? So let's go ahead and dive in. So what is computed tomography? It is cross-sectional images of the body that is heavily used to diagnose. And so they diagnose pathology and injuries and can rule out a lot of clinical diagnoses. So it's a very high use modality that guides physicians for treatment of their patients. Now, I want you to think as computed tomography, i.e. CT, CAT scan, whatever you're used to calling it, as a loaf of bread. So the sliced bread, so each slice represents an axial image because that's how we look at it on our monitor. Now, let's go ahead and describe some evolution of CT because a lot has changed and it's still evolving to this day. So CT scanners have evolved since being introduced into medical use in the 1970s. So in 1972, that's when it was introduced into medical use. So Godfrey Hounsfield, of course, if you're familiar with Hounsfield units, was one of the inventors of CT. All CT scanners today, they are based off of third generation technology. So we have a first, a second, and a fourth. There is fifth, sixth, and seventh, but usually most CT scanners out on the market, they're based off of third generation technology. So with that third generation technology, MDCT, so multi-detector CT, which has more than one detector, resulting in better image quality, was introduced. So you're talking about your 16, your 64, your 256, your 320 slices. Multi-detector, which it can rotate a lot faster with the X-ray tube around the patient. So with that, because of this technology, slip ring technology was also, introduced and made possible. So what that made possible is to make continuous rotation possible so the detectors and the X-ray tube rotate around the patient simultaneously together without high frequency cables. So any of you old techs know high frequency cable, how you used to tighten up and the X-ray tube had to spin the other way. I worked on a machine 20 plus years ago that was like that. So like I said, the X-ray tube and detectors rotate together. So what is the role of a CT technologist? So we know commonly is to operate the scanner. We're providing good patient comfort and care and safety to the patient because those things are very, very important. What's also important is correct patient positioning and how you administer contrast media when it's needed, because those are important parts, and I'll dive into that in later lessons. Capturing high quality images for radiologist interpretation, that is super important, and that is based off of your patient positioning and your image quality. So, and managing equipment and following radiation safety protocols. So those are very, very important, and I will dive a little bit deeper into that a little bit later on. Now, your common CT workflow, so this is your ER, inpatient, outpatient. So typically we get a lot of CT scans from the emergency room. So these are quick, urgent exams for trauma, strokes, acute conditions, things like that. And then we have our inpatient. So these are scheduled patients, time studies, stats on patients in the hospital, the ICU. So that's typically that workflow. And then of course our outpatients. These are routine, non-emergent, things that are scheduled, patients following up on testing, having their 3-month follow-up. So these things are scheduled more advanced. They're a little bit more streamlined, where in the ER, we have to kind of shuffle things around. Okay, so that is the end of lesson 1. I kind of made this a little bit brief just to kind of give you a nice summary. So hopefully you can take away a lot of these good pieces in your training, okay? So in lesson 2, we're going to talk about equipment and components, and I'm going to dive into some things that I feel that are important. Thank you for going ahead and so I will see you in lesson 2.